Yeah, I think we are on. Yep. Hello, everyone. My name is Associate Professor Hossein Afzali, and I'm a coordinator for postgraduate public health teaching programs. And in this session, I'm going to provide you with some information about these teaching programs. And if you have any questions, please let me know. I will provide all contact details that you need to contact me. So given this new situation around COVID-19, we moved to fully online information session. Our plan was to have a mixed mode of delivery, including some face-to-face. But we just moved to fully online session. So before I formally start, I would like to provide you with a message from our Vice Chancellor. It would be good to start with this message. It's short.
Hi, I'd like to take this opportunity to welcome you to Flinders University. Every year it's terrific to see new faces on campus and to know that so many people have chosen to study here at Flinders. I love walking through the hub, feeling that incredible buzz and seeing students just like you, talking to new friends, sharing ideas, helping each other out. These are just some of the things that make Flinders such a wonderful place to study, as I'm sure you'll discover once you find your feet. Your first few days may seem a bit of a blur. We've all been there. Starting university is a big step, and it takes time to learn all the ins and outs. But don't worry, plenty of support's available to help make your transition to life at Flinders as easy as possible. Flinders staff and student ambassadors can help you find your way. And I know from experience that your fellow students are kind, inclusive, and always ready to help. So where do you begin? Well, Flinders' website's a great starting point. You'll find campus maps and plenty of information about university life. Our Ask Flinders Facebook page will keep you up to date on university events and Flinders news. Flinders also has a busy social scene, and Flinders University Student Association, FUSA, can help you find social clubs and many other activities. As well as online support, we also provide support in person at our campus locations at Sturt, Tonsley, Victoria Square, regional South Australia, and across the Northern Territory. Here at Bedford Park, the Flinders Connect team in the hub can answer questions about enrolments and course information. The Student Learning Centre within Flinders Library is also a great resource for any academic help that you might need. Our confidential and professional health, counselling and disability services are available to all students. And Flinders Oasis drop-in centre is a warm and inviting space for people from all backgrounds to socialise. Oh, and of course, Bedford Park has plenty of food outlets, although I'm sure you've discovered those for yourself already. I'm confident that you're going to love being a student here at Flinders University, and I hope you're going to have the time of your life.
Okay. All right. Okay, so before starting the session, I wish to acknowledge and pay respect to the traditional custodians of the land upon which we meet. I would also like to acknowledge and pay respect to the elders of the land, both past and present. This session will be recorded, so you still can have, if you want later on, you can watch. And again, if you have any question, please let me know. So the main aim of this session is, as I said, to provide some information about the content, more specifically about the content, some general information regarding the structure of our postgraduate public health teaching programs here at Flinders, and some key sources in terms of the information that you need, so providing some guidance on some key issues around your study. But I think the first question is, why public health at Flinders University? Because if we answer this question, probably it answers a few issues or clarifies a few issues from your point of view. And to start with, I would like to highlight some key features of public health at Flinders Uni in terms of the key areas that we cover. As you know, different universities provide, even within MPH program, cover different areas of public health, depending on their expertise or the type of expertise that they have or experts that they have. And I think it's important for commencing students like you to understand what key areas in public health is covered within our MPH or Graduate Certificate in Public Health or Graduate Certificate in Health Promotion, are three key postgraduate public health teaching programs. So this slide is about a big picture. So it's our vision at Flinders University in terms of public health teaching program. So our vision is, when we designed this program, public health teaching programs, our vision is to improve your knowledge, and especially practical, and I want to highlight again, practical skills for practice of public health. And then I mentioned here two key or two broad areas within our public health teaching program. So our aim is to improve population health. So population health is one key and broad area within our public health teaching programs. How we can maximize population health. And then I said, while understanding the principles of equity in healthcare. So equity is another key area or broad area that we focus within our public health teaching programs, because sometimes there is a trade-off between maximization or maximizing population health and improving equity. So a good public health graduate should know the principles of population health and how to maximize population health, and at the same time some understanding of principles of equity, because as I said, sometimes there is a trade-off between these two broad areas within public health. So within our public health teaching programs, we try to focus and cover both key areas, equity as well as population health. More specifically, so that was our vision, broad picture, big picture, but more specifically, we provide or we try to improve your knowledge and skills in public health key areas. And in terms of key areas, we have 4 key areas to cover within our public health teaching programs. The first one is how to identify a public health problem, and especially key issues influencing public health problems. I think that would be the first step for any public health practitioners to get the knowledge and skills required to identify especially the roots of any public health problem. And I mention here including social determinants of health, which is one of our key areas that is covered by our public health teaching program. So, for example, if you look at one big public health problem like obesity, then it would be extremely naive to just focus on individuals to solve the problem, because there are lots of factors, several factors influencing or impacting this condition or this public health problem. So if you are not, as a public health graduate, if you are not familiar with the whole or the big picture or the factors that, apart from individual factors, that impacts the condition or public health problem, it would be really hard to fix the problem. So I think everything in public health starts with the identification, proper or appropriate identification of the problem, including all factors influencing public health problem. So that's just an example of one of the topics, social determinants of health, and we have a couple of other topics with the same aim and mission to focus on this key area of public health. Then the next step within the public health journey that we are trying to cover within our public health teaching program is to identify a solution, how to develop a solution. Now, first you identify the problem, including all factors influencing the problem. Now, how to develop a solution to fix the problem. And again, two key areas or broad areas within this stream is some skills and knowledge required to critically analyze existing policy and evidence in order to identify the gaps between the gaps in the existing policies or evidence. So that would be one big type of skills that a public health graduate needs. And again, we have across many topics within our public health teaching programs, critical analysis is part of our assignment. For example, in EPI, we have some sort of critical analysis of published literature in epidemiology, or even within the qualitative research method, one assignment would be critical analysis of published literature or policies or documents, as well as some other topics. So that would be a good area to cover for public health graduates in terms of critical analysis of existing policies and evidence. The second key area that we are going to cover within development of a solution would be principles of research methods. So the first one was about the existing evidence, but how about developing or generating a new evidence? To generate a new evidence, you need skills and knowledge in mixed methods, in qualitative methods, in quantitative methods. So for example, in qualitative, how do you conduct interviews, for example, focus group discussions, or in quantitative, how you, in terms of biostat skills, how to analyze the data in order to develop a solution. What is the best solution? Or in my topic, economic evidence for healthcare decision-making process, how to generate economic evidence in order to develop a solution, a cost-effective solution. So you can see different areas: economic evidence, epi evidence, biostat evidence, but with the same aim in terms of generating new evidence, providing skills and knowledge to generate new evidence, which help you develop a solution for a public health problem. The third key areas that we are going to cover within our public health teaching programs is leadership in public health, because again, that's a really important, another important area within public health. So we talk about, and there are a couple of topics. So we talk about approaches of and theories of leadership in public health, and how you can lead your solution, you can implement your solution. So that's another key area within our teaching programs. And finally, evaluation of healthcare intervention. So when you implement a healthcare intervention, whatever it is, it can be, for example, a lifestyle intervention for the management of diabetes or prevention of diabetes or obesity, or can be even a new surgical procedure for the management of prostate cancer versus existing. Whatever it is, when you implement, you need some skills to evaluate these healthcare interventions in order to identify whether or not this healthcare intervention is achieving its aims and goals as you defined previously. So the evaluation skills now is really important within public health area. And a public health practitioner or public health graduate should have this sort of knowledge and skills in terms of how to evaluate a healthcare intervention. And here I mention a few areas within evaluation of healthcare intervention, including the evaluation of acceptability of the intervention, proposed intervention, new intervention, effectiveness, as well as cost effectiveness. Effectiveness and cost effectiveness, they are emerging areas in terms of especially cost effectiveness, how to evaluate both cost and effects to inform, for example, in some cases, public funding decisions. So we try to cover these 4 key areas in public health within our teaching program, especially within our postgraduate teaching program. In addition to these key areas, we also, through different assignments or different activities across our topics, we try to improve your skills in terms of teamwork. Again, that's one of the key area within any professions, including public health, to learn how to work together and identify or develop a solution for a problem, as well as communication skills. So we have a range of assignments, again, across different topics to improve your communication skills. For example, if we have a couple of topics asking for drafting a report, a scientific report. This is really important skills, because even you know how to talk, in many cases you should communicate your findings or your understanding through, for example, a report, drafting a report, or in, for example, manuscript as well. So these sort of topics with those assignments help you improve your skills in terms of how to communicate with your supervisors or different academic groups or in a conference or something like that. So again, a range of oral presentation in different topics, in some topics, as well as drafting reports and manuscript to present your findings and as well as your understanding. Another key feature of our public health teaching program is to offer a broad range of option topics. Again, as a course coordinator, I think this is one of the key issues within any public health teaching programs, or any teaching programs, I have to say, because the core topics, they are core topics, you have to take it. But in terms of option topics, you should have a broad range of options to choose. So within our program, we have a range of contents that are covered by our option topics. And I just mentioned a few examples here: public health and nutrition, aged care services. Again, some of you might be interested in aged care. Chronic condition management. So we have 3 topics, one as a core for 2-year MPH, and two of them as option topics. In terms of management of chronic condition, the principles of management of chronic condition, given the significance and importance of chronic conditions and its impact on public health. Environmental health is another area that we try to cover within our option topics for those who are interested. Health, law, and ethics is another area. Primary health care, especially in developing countries. So this sort of option topics, again, help you to understand or give you this opportunity to choose from a broad range of contents, all related to public health, but different areas. The second feature that I have to talk about is student-centered learning. So we have, again, within across many topics, including especially those more qualitative topics. There is a range of assignments and activities, not necessarily assignments, activities to engage students, to engage you in group discussion, discussion board, and some of them actually is a kind of assignment within the activity is counted towards your assignment, towards your final grade. How actively you participate in discussion forum, because every topic has a discussion forum. So how actively you engage in questions or even answering questions from other students. These sort of activities are closely monitored by our topic coordinators, our excellent topic coordinators, I have to say, to make sure that the level of engagement is at satisfactory level from topic coordinators' point of view, because that's a key part of learning process. Part of learning is a part of learning process within our teaching programs. The third one is online delivery, and of course, given all these problems that we had or public health problem that we had, we have now and over the past couple of years. So online delivery is a must now for teaching programs. So all topics are delivered online as well, depending on the situation. Now, all topics, just the online delivery is the only mode of delivery now, but with some changes in restrictions. Some topics may have some sort of limited face-to-face as well. And again, as a course coordinator, I understand the significance and importance of face-to-face session for some students. We do understand, and we try our best whenever it is possible, given the situation, because sometimes it's not under our control. So we have to just follow the rules set by authorities and public health authorities within our state. But we try our best when it is possible, whenever it is possible, to offer or deliver some sort of face-to-face practicals, especially practicals. Usually lectures are all online, but for practicals, if it is possible. But this online delivery also provides some sort of flexibility for many students, and several students actually prefer this sort of thing because everything will be recorded and they can watch the recorded lecture or recorded practical whenever they want. But I highly recommend, that's my recommendation, whenever you can, please attend your online session. This is really important because this is a kind of student engagement, any questions, any answers. I know that you can watch it later, but this sort of attendance, online attendance, would be really good. For example, for lecture, again, different, so you have to follow the study guides provided by different topics. Some topics, like my topic, economic evaluation, lectures are online, but it's a live online, so it's not pre-recorded. So it would be good for students to attend this online lecture, live lecture. And some topics, some topic coordinators may record some of their lectures, pre-recorded, and then you can watch the pre-recorded lecture, and of course there will be some sort of live sessions as well to answer your questions or clarify some issues. So you have to just, as I said, follow your the study guides for specific topics that you enrolled in. Another key feature is research opportunities. So I will talk a little bit about this, but at the end of usually towards the end of your MPH program, this is not for graduate certificate students, you have opportunities to choose. If you meet some eligibility criteria, you have an option to choose the research pathway. So it would be a small scale research, so like a master MPH dissertation, and then during, I think it's sometimes 6 months, again you can choose 6 months to 1 year, depending on the project and supervisor recommendation. You can do a small scale research, which is really good because the end product would be a manuscript as one of the assignments, which can be published, and that's our aim, to be publishable. And it would be good for your CV, as well as your experience, depending on what sort of job you are thinking of, whether or not you want to continue your study as a PhD student or research student or job related to research. So that sort of opportunities are there, so depending on your choice. Industry placement opportunities, especially from next year, we are going to have more structured opportunities for those who are interested in industry placement, which is, again, that's a good feature of any public health teaching programs. And finally, I mentioned highly experienced national and international research leaders and their inputs into our teaching programs. Some of them actually are topic coordinators. Some of them actually contribute to the topics by giving lectures or practical, because we have a really good team with expertise in different areas, including infectious disease, smoking, social determinant of health, as I said, Aboriginal health, economic evaluation, as well as some other areas like cancer and this sort of thing. So really knowledgeable team in terms of an experienced team in both teaching and research. A little bit about Flinders University. I think it's good to know, just briefly. So we have 6 colleges within our university, and we are within College of Medicine and Public Health. So the discipline of public health is within College of Medicine and Public Health. There are a range of clinical and health-related teaching programs within this college, within the College of Medicine and Public Health. Of course, medicine, chronic condition management, CBT, biotech, paramedic science, and public health. So these are the key teaching programs within the College of Medicine and Public Health. And again, we have some students from public health moving to, for example, CBT, or vice versa, CBT coming to public health. So there is a range of options that you can consider, and I'm more than happy to provide any information outside of public health. This is my role as well, if you need more information. Or if I don't have information, I can direct you to the right person to get right information. And these 2 links and websites are really, really important. Again, I highly encourage you to look at these 2 websites, 2 links. The first one is about course rules, admission requirement, and the core topics and option topics. The second for MPH Graduate Certificate in Public Health. The second one is about the course rules and admission requirement and more information about Graduate Certificate in Health Promotion. As I said, you need to visit all these websites, and if you are not clear about option topics or the content or the structure, again, I'm more than happy to talk with you. This slide provides an overview of our postgraduate public health teaching programs. As I said, we have MPH Graduate Certificate in Public Health and Graduate Certificate in Health Promotion. So Master of Public Health, we have 2 types of programs, 2 separate programs, 2 years and 1.5 years, 72 units or 54 units respectively. And of course, depending on eligibility, different eligibility criteria, whether or not you are eligible for 2-year program or 1.5 year program. Then we have graduate certificate, only 18 units, and can be done in 6 months to 1 year, depending on whether or not you start in the first semester or second semester mid-year entry. So it includes only 18 units of topics. And most topics within our teaching programs, graduate certificate and public health, are 4.5 unit topics. Although we have a few 9-unit topics, which of course is more complex in terms of content and assignment. But for those who are interested in having or doing 9-unit topic, there are some options. Again, I can provide more information for those who are interested. Each topic, as I said, has a study guide or topic guide. So when you enroll in your topic and when you have access to Flow, and everybody now should have access to Flow, usually 1 week before starting the semester, you can, and again, I highly recommend you need to look at a study guide, because the study guide provides all key information about that particular topic, including timetabling, including type of assignments and assessment deadline. And then if you have any question or you are not clear about some parts of your study guide, then definitely you need to ask your topic coordinator. And I'm quite sure that everything is available, even within the study guide, the contact details of topic coordinator is available. And as a rule, as a general rule, full-time students can normally complete 18 units of a study in a semester. So if we consider 4.5 units as our standard units of topic, then you can take or you can do 4 topics in each semester. And again, as a course coordinator, I'm against overloading more than 4 units. It would be hard and again, based on my experience that I had over the past couple of years, some students think that they can do 5 topics, but practically is not. I'm not saying it's not possible, because we had a few examples, but is really, really hard. So stick to your, as a full-time, if you want to do full-time, I think 18 units of a study or 4 topics would be more than enough. So stick to your, to our recommend, I mean, in terms of program of a study, just 4 topics. This slide shows how graduate certificates and MPH are linked to each other. So for those students, commencing students doing graduate certificate in public health or health promotion, so after you finish your degree, completing your degree in 6 months or 1 year, then you can, all the credits, 18 units, are counted towards your MPH if you want to do MPH, if you think MPH is also on your, as an option. So that means if you are eligible for our 2-year program, a 72-unit MPH program, if you finish your graduate certificate, that means you have already, when you're enrolled in MPH, that means you have already done 18 units, so 54 units left. And there is also an option for those who, for various reasons, they can't complete, especially mainly is about, or commonly is about, family situation and unpredictable situations that may happen to all of us. So if they meet some eligibility criteria in terms of the number of topics, the type of topics that they have done within their MPH, then the exit award is graduate diploma, which is 36 units. So still, you haven't finished your MPH, but given the number of units and topics, type of topics that you did, then you might be eligible for graduate diploma in public health. So that is another option for MPH students. I don't know what happened here in terms of our lights. Just give me 1 second to see if I can. Okay, I think now it's better. All right. So next one is just, again, show you how it works. So we have MPH applicant, if it is he or she is eligible for advanced entry, and when I say advanced entry is 54 unit, then we have 1.5 years, and again, there are 2 streams, as I mentioned, about research opportunity. So student can choose coursework, which includes 36 units of core topic, plus 18 units of option topics, or coursework plus research, and 27 units of core topics, 9 units of option topics, plus 18 units of research dissertation. That part, and this is the same for, I mean, in terms of the choice of research, is the same for 72 unit or 2 years, 2-year program here at this part, this section. So it's about public health dissertation, as I said. So we assign a supervisor, examiners, and then you do your research under closely monitored by your supervisors, and feedback, lots of feedback from supervisors usually. And then you can finish this 18, so that's 18 units of topic, and can be done in one semester. Again, I don't recommend one semester for public health research dissertation, or can be done more appropriately across 2 semesters, so in 1 year. Again, when you get to that point, which is towards the end of your course, your program, then you need to contact me, and we go through a process, and we talk about this opportunity. That's just some topics. I'm quite sure you have visited the website. So type of topics that we have this is for 2-year program. So as you can see, in terms of core topics, we have for coursework. We have a range of topics, a broad range of topics in terms of economic evaluation, biostat, qualitative, Aboriginal health, social determinants, managing of chronic and leadership topic. So now you can see that those areas that I was talking about in terms of key public health areas, we are trying to cover within our core topics, and then a range of option topics, as I mentioned. Maybe you are also interested in aged care or public health nutrition. And then if, because there are 2 streams, if you choose public health dissertation, this is the 18 units that I was talking about, or no, you are not interested in research, or is not for you, or is it doesn't really relate to your future job, whatever you think of. So no worries. So still you can do your coursework part, which is then instead of research dissertation, you can do your public health practice development. And within this public health practice development, which is a coursework, putting all together, so it is a good topic. It's a 9-unit topic. It's a good topic. It's a capstone topic. And then within this, there might be some opportunity for industry placement as well. And this is for 1.5 years. And of course, then the core topics would be, the number of core topics would be less, recognizing your prior experience or knowledge and skills in public health. Again, everything is available in our website. A little bit about graduate certificate, because I know some of you just enrolled in graduate certificate, commencing as students. So the main aim is just to provide some introductory courses of a study for a range of professionals. We have, over the past few years, we had a range of professionals, including even doctors, medical doctors, or paramedic, nurses, a range of professionals interested in completing graduate certificate in public health or health promotion, just to upskill, especially in terms of public health, given the situation that we had over the past couple of years. It's 6 months, can be done in 6 months, and it's 18 units of a study. So that is graduate certificate in public health with one core topic, social determinant of health, and then you can choose one topic from this list. How many topics? 1 to 5 topics, and then 9 units of topics as option topics. So as you can see, it's not really prescriptive. So except social determinant of health, which is our flagship topic, then you have a choice in terms of key areas. So those 5 topics are key areas and are core topics for MPH as well. So by choosing one of them, actually it would be easier for those who are interested to continue their study as MPH. So that, again, that facilitates this process. So you can choose one of those cores or essential knowledge. And then we have, again, so half or 50% of the program is option topics, give you some sort of flexibility to choose from. And this is graduate certificate in health promotion. Of course, because it's graduate certificate in health promotion, then it would be, health promotion in public health as a core topic. Again, if you have any question, I am happy to answer your questions. Send me an email or contact me. That's just an example of a study plan. I highly recommend you to look at or visit public health course website, which is really, really important because it provides you with information at the course level, including some pathways, standard pathways or recommended pathways in terms of which topics we recommend to take in which semester. As you know, not all topics are offered in both semesters. Some topics are offered in only first semester or some topics are offered in second semester only. We have some non-semester topics as well. So, for example, right after semester 1, before starting semester 2, or before starting semester 1, kind of summer topic. For those, again, just want to finish it a little bit earlier. So in kind of intensive or semi-intensive topics that we offer. But again, I have to say, if you have any question or is not clear, please contact me in terms of your study plan, especially for international students. If they are not clear about which topics they need to take, please contact me. That actually prevents some problems that we had with some students. Not students' fault, because sometimes it's not clear for some students, although we expect as a postgraduate students, you can effectively communicate. You need to effectively communicate with your course coordinator and topic coordinator if you have any questions or is not clear to you. So please contact me if you have any question about the study plan. In terms of career, I'm looking at time, so we have only 10 minutes. So potential employers would be both academic and non-academic organizations, like Department of Health. Here in Australia, we have Department of Health, state and federal. So public health graduates would be a good employee for Department of Health. PHN or primary health networks, Cancer Council, research institutes or centers, Diabetes Australia, Heart Foundation, aged care sectors, universities. These are potential employers for public health graduates, depending on the skills and knowledge that they need, or in terms of, sometimes it's just a project-based job. So they have a specific project, for example, a qualitative project or a quantitative project, and they want the skills required for that particular project. Sometimes it's broader. For example, the evaluation, they need evaluation skills to evaluate a range of healthcare programs. For example, for primary health networks, that would be a case, lots of evaluation, several evaluation officers. And then potential occupations would be public health officer, for example, program development, program evaluation, as I mentioned, project manager for a specific project, health data or health information officer, I think it's clear, health promotion officer, especially for those who complete health graduate certificate in health promotion or do our health promotion topic, which is very popular. Clinical trial coordinator with knowledge in EPI and biostat, health protection and safety manager, research officer or research associate within universities. Sometimes we need some sort of junior researcher. So of course that level of research skills is important, and knowledge is important, and future study, for example, upgrading to PhD. This slide, that's still, it's about academic integrity at Flinders University. We take it, as I mentioned here, very seriously. That's really, really important. So it's really critical for you to visit our academic integrity policies. What is the definition, how we detect this, and how we in terms of our process to detect and to identify these breaches. So I think there is lots of information in this website that I mentioned here. This website. Please visit this website, because I know some of you, not all of you, some of you are not. Okay, generally we don't have any problem with many of you, but in some cases, if you have problem, in many cases within this small cohort of students, the reason is that they are not familiar with the policy, so I think it's important to just visit the policy, making sure that you understand the policy, and we have an excellent officer, integrity officer within our college. If you have any question, just let me know, or I can direct you to our integrity officer if you have any question or any you need any clarification regarding this issue. And I think you know that we have a system that can identify these breaches very easily. And again, I'm quite sure 99% of you, even more than 99%, the reason is that because you are not familiar with the policy or you don't know. So that's why I just repeat again, please visit this website for all information. There is a video here. You can just watch the video, which talks about different types of problems, and I think that would be very informative. And this website, again, provides you with lots of key information regarding for commencing a student, regarding flow, the student system, and your email, your student ID, and fan details. Lots of critical information. Again, I'm sure that you get this information from our enrollment department or other department, but I think that's important to have a quick look at this. This is the website that I was talking about, Postgraduate Public Health, providing information at course level. You all have access to this course, and from time to time I make an announcement which is at the course level. Some job opportunities, some excellent lectures, so different types of communication within this. And as I said, there are lots of information about the course, including course handbook. Again, I recommend you to read the course handbook, as well as some recommended pathway in terms of a study plan. Okay. I think you can have a look at these slides, because this session is recorded and uploaded. We will provide where you can find the recorded session. I also upload the slides, on Public Health course website, and then make an announcement. Again, you can just have a look at all these slides, including these websites in terms of critical enrollment dates, payment due date, semester dates, flow. If you need any help, you should be relatively confident to use and communicate with the flow, because this is the major teaching and communication platforms within our teaching programs. So if you are not clear, you are not sure, please let me know. And there are lots of support here. You can have a look at these websites. Then again, information regarding enrollment support, exams, fees, again, student support and services, range of services and support in terms of health services, mental health support if you need it, and library resources. Again, that's really, really important. And finally, this is my phone number as well as email address. I think, again, it's very critical for you to understand the distinction between two types of question. Broadly, you may have two types of question. One type of question would be about your enrollment, credit transfer. For example, if you did some previous study and you want to transfer the credit towards your current program or teaching program, leave request, all these things, you should direct your question to Ask Flinders. All right, that's really important. I usually don't respond to this sort of questions. So you have to know which question go to which sources to get your answer as soon as possible. But if you have any question regarding content of your program, you are not sure about this topic, you are not sure about the structure and a study plan, sorry, just 5 minutes. Okay. And structure and study plan, then you have to contact me. All right? So thank you very much. So if you have any question, please send me an email or you can call me. I'm more than happy to set up online meeting as well. Thank you very much.